Welcome to this video. In this video we're going to discuss different causes of headaches. So to begin with, let's start by just making clear what a headache actually is. So just looking at the word headache, it literally means pain in the head region of the body. Now, of course, when we use the term headache in normal conversation, we usually use it to mean pain in the portion of the head that actually surrounds the brain. So, for instance, pain in the forehead region, pain in the temporal regions, pain in the top of the head or pain in the back of the head, the occipital region, all of these parts of the head that surround the brain inside. When you get pain in those regions, we would commonly refer to that as a headache. However, lesson number 1 of this video is that a headache, the term headache, is broader than that. It literally means pain anywhere in the head. In particular, pain in the facial region of the head also counts as a headache, even though in normal conversation we might not call that a headache, we might call that facial pain instead. But facial pain does count under the term of headache, and indeed some of the causes of headache that we're going to go over in this video would actually lead to facial pain rather than pain in the regions of the head that actually surround the brain. So, the next thing I'd like to do is get you excited for the video by telling you all the different topics that we're going to cover in this video. So, things we're going to cover: tension type headaches. We'll begin with tension type headaches. We'll then go on to migraine headaches, cluster headaches. We'll talk about intracranial hypertension as a cause of headache. And of course, there are loads of different causes of intracranial hypertension. We'll go over some of those. We'll talk about low pressure headaches, also called intracranial hypotension. We'll talk about infectious causes of headaches, such as sinusitis and meningitis. We'll talk about trigeminal neuralgia, which is a neuropathic form of pain that results in mainly pain in the facial region of the head. We'll talk about giant cell arteritis, and we'll end the video by talking about glaucoma. So those are all the different topics that we're going to hope to cover in this video. Now, let me tell you about some of the things that I'm not going to cover in this video. So, we've done the things I'm going to cover, things that I'm going to steer well clear of. I'm going to steer well clear of toothache and earache. Now, of course, in principle, you could classify toothache and earache as headache because they are pain in the head region of the body. However, we generally treat those separately to headache, and I will agree with that philosophy and steer well clear of those. The other thing that I'm not going to talk about, even though I'll mention it now here, but after this I won't mention it again, is the fact that if you damage superficial tissues in the head region, that will lead to pain in the head region. So for instance, if you cut the skin over the head region, or you damage the muscle tissues in the head region, or other superficial tissues in the head region, if you damage superficial tissues, that will lead to pain. Now, I'm not going to talk about that because, of course, the mechanism is exactly the same as anywhere else in the body. It's true that if you damage superficial tissues anywhere in the body, you will feel pain in that region of the body. So it's not something that's unique to the head at all. And therefore, we're not going to talk about it because it's not something that's unique to the head. It's not something that's particularly interesting. It's common knowledge. We're going to talk about causes of pain in the head that are more unique to the head region. Okay, so the first thing to do then in this video is to talk about an old categorization of headaches. Now, this is, as I say, an old categorization, and the old definitions of these two categories are not particularly brilliant anymore. If you think about them too deeply, they break down. However, it's an important categorization because everyone uses it and everyone expects you to know it. So I'm going to go over it nevertheless. So the two categories that we split headaches, all of the headaches that I'm going to talk about into, are primary headaches. So one of the categories is primary headaches. And then the second category is secondary headaches. So we can put all of the headaches that I'm going to discuss into one of these two categories. So, as I say, this is an old way of categorizing headaches, and there are the old definitions of what primary versus secondary actually means. However, as I say, those definitions start to break down with our modern understanding of the causes of these different types of headaches, and therefore I will also give you a more modern way of thinking about the difference between primary and secondary headaches, which makes slightly more sense. Okay, so let me first then give you the original definition of primary versus secondary. So, before I do this, let me tell you which of the headaches that we're going to discuss goes in each of these categories. So we'll start with primary here. So the first three types of headache that I'm going to discuss in this video are all primary headaches. So, tension type headaches, migraine headaches, and cluster headaches, they all come under this category of primary headaches. Whereas the later things that we're going to discuss in this video, intracranial hypertension, low pressure headaches, meningitis, sinusitis, trigeminal neuralgia, giant cell arteritis, glaucoma, all of those come under the category of secondary headaches. Now, when they originally came up with this categorization, the pathophysiology underlying the primary headaches was not known. So we did not know where migraines came from. We did not know where tension type headaches came from. We did not know where cluster headaches came from. And at the time, they could not find anything wrong with the brains of the people with suffering from these types of headache disorders. So they concluded that there was no underlying disease causing the headache, and therefore the headache was a primary headache because it emerged on its own without some disease that it was secondary to. The disease was the headache, the illness was the headache, rather than just being a symptom of another disease. So primary headaches, the original definition of those was that they had no underlying disease that was causing them. Whereas the secondary headaches, intracranial hypertension, intracranial hypotension, meningitis, sinusitis, trigeminal neuralgia, giant cell arteritis, glaucoma, there was always a very obvious underlying disease. They knew what was causing it. The headache was just a symptom of an underlying disease. And therefore, they said these headaches are secondary to an underlying disease, therefore we'll call them secondary headaches. So that was the original definition of the difference between primary and secondary headaches. Primary headaches had no underlying disease causing them. Secondary headaches were secondary to an underlying disease. Now, of course, we have advanced since then, and we now understand to a better degree what the pathophysiology underlying the primary headaches actually is. And we know that there is something happening in the brain that is causing the headache. So there is an underlying process that we could describe as a disease process that is actually causing the headache. And therefore, this categorization of saying that primary headaches have no underlying disease seems to start to break down. So, here is the more modern way of thinking about the difference between a primary headache and a secondary headache. Primary headaches are those headaches where the underlying cause, the thing that is causing them, is not believed to be dangerous. Whereas the secondary headaches are those where the thing that is causing the headache is believed to be dangerous or is dangerous. So, I remember a neurologist once saying to me that the primary headaches were the ones that were unpleasant but not dangerous. The thing that's causing them isn't going to kill you. Whereas the secondary headaches are those ones that are unpleasant and dangerous. So that's the more modern way of thinking about the difference between primary and secondary headaches, and that is really the way I will be using the terms primary and secondary headaches throughout this video. So, let's now begin. We're going to start by discussing a type of primary headache, which is tension type headaches, the first one on my list. Now, just before I actually do start discussing this, I want to do a speech about the nature of science at this point. So, remember, science is just models to help us understand this reality that we live in. And these models may well be proven wrong. I am going to discuss with you a whole bunch of models for what is happening in these situations in real life, in these conditions, these real conditions. However, these models may well be wrong, particularly in the case of some of the primary headaches. So tension type headaches, migraine headaches, and cluster headaches, their pathophysiology is not that well understood. There is holes in their pathophysiology, particularly for tension type headaches and cluster headaches. Migraine headaches, we've got a much more satisfying theory, a much more rich theory at the moment. But tension type headaches and cluster headaches, we've got a quite poor theory. We've got a very early stage theory. So my warning at this point is that I am going to tell you theories of what causes, what is actually happening to cause these types of headache. However, they are our best current theory, and in 50 years' time we may have a much better theory. In fact, I hope we probably will have a much better theory, and it may turn out that either the theories that I am presenting here are completely, completely bare skeleton. They've got huge holes in and they need to be filled in, or they're completely wrong altogether and there's some completely different theory in 50 years' time. So that's the warning that I need to give you, that some of the stuff that I tell you in this video may go out of date, because that's the nature of science. Okay, so let's now begin. So we're going to talk about tension type headaches. So first thing to do is obviously write down the name of this type of headache, and I will pick a nice red colour for this. So we're going to discuss tension type headaches. So this type of headache is the most common type of headache, which is why I'm starting with it. You might be wondering, why is he starting with this? I've never heard of tension type headaches. And until I'd been to medical school, I'd never heard of tension type headaches, whereas everyone has heard about migraines. You might think, why isn't he starting with migraines? It's because tension type headaches are actually more common than migraines. Even though in normal conversation people use the term migraine synonymously with headache, when someone's suffering from a headache, which is probably a tension type headache that they've got, they love to say, I've got a migraine. They haven't most likely got a migraine. Migraine is much, much more severe than tension type headache. But people use the term incorrectly. They use it as though it's synonymous with headache. It's not. A migraine is a specific type of headache that is rarer than tension type headaches. Most people, when they get a headache, it will be a tension type headache rather than a migraine type headache. So tension type headaches is where we're going to begin with. This is the only type of headache that I have ever suffered from in my life. So tension type headaches is the one that we're going to start off with. So tension type headaches, we can also abbreviate this down to TTHs, tension type headaches, shortened. And other names for this type of headache, some people will just call it tension headache. However, I prefer the term tension type headache because there are lots of different things that can trigger this type of headache, and they'll all have slightly different, potentially, pathophysiologies, but they all cause this same overall type of headache. Therefore, I think it's best to call it tension type headache rather than just referring to it as tension headache. Another name for tension type headaches is stress headaches. And this is the more common name for this type of headache that's used in normal conversation. So if people are a little bit more wiser about headaches and aren't going to describe their headache as a migraine because they know better, they know that the type of headache they're suffering from is not a migraine, that migraines are much more worse, they might describe the type of headache that they're suffering from as a stress headache, and that's another name for a tension type headache. So all of these names, tension type headaches, tension headaches, TTHs, stress headaches, they all refer to the same type of headache, which is the most common type of headache. Now, most people on this planet will suffer from one of these at least a year, probably more. I think I've had about 3 of them so far in 2016, and it's now the beginning of April. So most people will suffer from tension type headaches occasionally in any year. This is the type of headache that people get when they've had a very stressful day at work and very emotionally stressful day, and then they come home and they get a headache. This is the type of headache they've got. Or if you've got flu or a cold or maybe a tummy bug and you get a headache as an accompanying symptom of that, this is the type of headache you're getting, a tension type headache. It is the most common type of headache. So let's now just do a description of what this headache actually feels like, and hopefully you will be able to remember back to the last time you had a headache and think about that and think about how you would describe the pain, and you'll agree that this description that I'm about to give you actually matches that. So let's write down a few key words about this type of headache. So the pain is on both sides of the head. It's a bilateral headache, and that's the first thing that contrasts this to migraine headaches. Migraine headaches are usually unilateral. They're usually just on one side of the head rather than being on both sides of the head. Of course, migraines can be on both sides of the head, but it's more usual for them to be on just one side of the head. And when we come on to the pathophysiology of migraine headaches, you'll understand why that is. Whereas tension type headaches, they are on both sides of the head, so it's symmetric on both sides of the head. The pain is not that severe. Migraines are much more severe than tension type headaches. So we would describe the severity of the pain in tension type headaches as mild, maybe it can go up to moderate. And you will probably remember the last time you had flu and you had a cracking headache with that. That was probably a moderate tension type headache. Whereas if you've had only a slightly stressful day at work and you come in and you've got a mild headache that's just a little bit annoying rather than actually being properly painful and stopping you from being able to perform your normal activities, that's what we would call a mild tension type headache. So the pain's usually mild to moderate. We wouldn't say it ever usually gets up to severe, whereas migraine headaches can get up to severe. So it's the same on both sides. Severity is mild to moderate. Now we need to talk about its character. What does the pain actually feel like? Well, this is the important bit. This is why it's called tension type headache. It feels like squeezing usually. Hopefully you'll remember this. Last time you've had a headache, you remember that sort of squeezing feeling, as though something is pushing in on your skull, as though something's trying to squeeze your skull. That is the feeling of a tension type headache. So the character of the pain is this squeezing pain. Now often tension type headaches are just in the temporal regions of the head, so above the ears, the sides of the head, that sort of region of the head, that's the temporal region. So you get a squeezing feeling from both sides of your head. However, in more severe tension type headaches, so tension type headaches may be going up to the moderate severity, maybe the sort of tension type headache you would get if you've had a really, really stressful day, or if you've got flu or some other nasty but common infection. It can go into the frontal region of your head as well, the forehead region, and also the occipital region, the back of your head. And therefore you can feel squeezing from all the way around your head. And then people often describe it as though they've got like an elastic band around their head that is squeezing their head. Whoops, where's the pen? So squeezing, and I'll put in brackets here that it is almost band-like when it goes all the way around the head. Okay, so that is a description of what the tension type headache feels like. It is a headache that usually is around the portion of the head that actually surrounds the brain, and it feels like it's squeezing. It's usually just in the temporal regions, therefore you feel a squeezing from both sides on your skull, but if it goes all the way around into the occipital region and the forehead region, the frontal region as well, then you can feel like there's a band around your head that's squeezing in. But usually the severity of the pain is not too bad. Now, an important accompanying symptom that people can get with tension type headaches is that you can often feel quite sick. You can feel nauseous. And some people, if the headache's bad enough, will actually even vomit. So I'll just put this down here. So accompanying, you can also get nausea and vomiting, and we will see that this is a bit of a running theme. Throughout this video, we'll see that most of the different types of headache that we're going to discuss can be accompanied by nausea and vomiting. So because I don't want to have to continuously write out nausea and vomiting, I'm going to use a nice little abbreviation for nausea and vomiting. N plus V is a nice abbreviation for nausea and vomiting. So learn that. We will be using it a lot from now on, rather than having to write out nausea and vomiting in full. Okay, so you can feel a little bit sick, a little bit queasy when you've got this headache, and some people, if the headache's severe enough, will actually vomit with the headache. And we will see the mechanism underlying that, or believed to underlie that. Pain causes you to feel sick, usually, and we will see the mechanism underlying that later on. Right, so we've now described this type of headache, a little bit of terminology now for you. Two pieces of terminology. Someone can be suffering from episodic tension type headaches, or they can be suffering from chronic tension type headaches. So let me put these two pieces of terminology here in red. So we split tension type headaches up into these two categories: episodic tension type headaches, so episodic, and we can abbreviate episodic tension type headaches down to E and then TTHs. And this is what most people have and which most people do not seek medical attention for. It's where, from time to time you get one of these types of headache. Maybe you've had an extremely stressful day, or maybe you've got the flu, or a cold, or a tummy bug, and you get this as an accompanying symptom. That we would describe as episodic tension type headaches. It's not a problem for most people. Most people can deal with it. They can take paracetamol or some other over-the-counter drug, and we'll discuss later how those drugs work, and they can deal with it. They will not seek medical attention for it. It becomes a real problem when it becomes chronic. So this is a total different ballgame now. Chronic tension type headaches, which is abbreviated down to CTTHs. And this is where you are getting these things extremely regularly, almost every day. So the definition of chronic tension type headaches is that you get one of these tension type headaches on greater than or equal to 15 days in a month. So in 1 month, you need to get on 15 of the days in that, or greater than 15 days in that, a tension type headache, and then we would say that you are suffering from chronic tension type headaches. So when they're extremely regular and you're getting them almost every day, and the threshold is that you're getting them on more than or equal to 15 days in a single month, then we say that you are suffering from chronic tension type headaches, and this is more of a problem. Episodic tension type headaches is everyone in the world, pretty much. Everyone in the world will get occasional episodic tension type headaches. Far fewer people suffer from chronic tension type headaches. I think the figure that people generally give is that 2% of the population suffer from chronic tension type headaches. So let's now talk about what can trigger these tension type headaches. What actually causes them? Well, we've already been discussing this. We've said that having a very stressful day can then lead you to have one of these tension type headaches, or that having the flu, a cold, a tummy bug can lead you to have one of these tension type headaches. But there are some other triggers, and we'll discuss later on the pathophysiology behind how we believe having a very stressful day, or having flu, a cold, or a tummy bug can lead to you getting one of these tension type headaches. But for now, let's just list out the different triggers. So I'll get another colour. I'm getting a little bit fed up of pink and red. So let me put a little title here. We're now going to discuss the triggers for tension type headaches. And as I say, we're not at the moment discussing how these triggers can lead to it. We will discuss that later on. So, triggers, of course, number one on there, emotional stress. If you've had a very emotionally stressful day, then you can end up getting a tension type headache. So, emotional stress. In fact, the last time I got a tension type headache was when I was in a mock exam, one of these role play exams where you have to, where there are actors playing patients and you have to take histories off them or do examinations on them. One of those exams. By the end of that, I had a tension type headache, a mild tension type headache, and it was because of the emotional stress of having to go through the exam. Even though it was just a mock exam, the it was the first one of these role play exams that I've done like that, and it did take its toll on me. It gave me a tension type headache. So emotional stress can trigger tension type headaches, and we will discuss later the theory of why, how it can cause tension type headaches. So emotional stress is definitely a trigger for tension type headaches, and I hope everyone agrees from sort of common knowledge about normal life that is true. Other triggers that are acknowledged to be there, and I will discuss flu, colds, and tummy bugs later on because I've got a large amount to discuss about those. I'm just going to do two more briefly. Other triggers are other types of stressors on the body, not necessarily emotional stressors. These are more physiological stressors. So one of them is fasting. So fasting, of course, means that you're not eating. So you're not eating the amount of food that your body is expecting to receive. This is a physiological stress. The body does not like it when it does not get fed. So it initiates a stress response to what it thinks is a food shortage. And this can trigger tension type headaches. So when people fast, they can find that they can then get tension type headaches. So another type of stress here. And then another type of stress here, again a more physiological one, is sleep deprivation. So if you're not getting enough sleep, this can cause you to get tension type headaches. If you missed a night's sleep, you might find the next day that, along with feeling extremely tired, you might be suffering from tension type headaches. So sleep deprivation is acknowledged as another trigger of tension type headaches. And now let me discuss the one that I've got a lot to say about, which is the fact that flu, colds, and tummy bugs, the common infections, can cause this type of headache. Now, this is where it starts, this categorization of primary and secondary headaches. Again, it's, putting its foot in here and making things awkward. Because remember, the old definition was that primary headaches had no underlying disease and secondary headaches did have an underlying disease. I told you that tension type headaches are a primary type of headache, and now I'm telling you that this is the type of headache you get as a symptom when you get flu or a cold or what was the other one I said? The tummy bug. Those are underlying diseases. Surely this should be a secondary headache. And this is why I would urge you not to really get too het up about this categorization. It is just a man-made categorization because we like categorizing things. Don't get too het up about it. It is this type of headache. The pathophysiology of where the pain is coming from is believed to be the same when you get one of these with these sort of stresses as compared to an infectious stress. And indeed, infection is another type of stress. It's infectious stress, it's a strain on the body. So you can kind of see that they all sort of do go together. They're all things, that are difficult for the body to cope with, stress on the body. And also remember the more modern categorization I gave you. Primary headaches are the ones which are unpleasant but not dangerous. The underlying cause is not dangerous. For most people, getting a cold or getting the flu or getting a tummy bug is not going to be dangerous. The common infections, they're not going to be dangerous unless you're immunosuppressed. So it kind of still works with the categorization, but as I say, don't get too het up about the categorization. It is man-made and it is fallible. So, I'm going to put it on here. So, one of the triggers is inflammation anywhere in the body. So remember, the inflammatory response, inflammation, it is part of the immune response. It is part of the innate immune response because it is not specific to the pathogen. It's a response that we initiate in response to any pathogen. So when you get an infection, we want to destroy that infection. We don't like the fact that this pathogen is present within our tissue, living inside us. So what we need to do is we need to bring in troops to that tissue that's infected that will be able to annihilate the pathogen. Where are all the troops that can annihilate pathogens? They are in the blood. In the blood, we have proteins such as the complement proteins put into the blood by the liver, which can attack pathogens. We also have loads of white blood cells of many different types that are capable of attacking pathogens. In the inflammatory response, it's a response in the microvasculature, the tiny little blood vessels that go through a tissue, where they start allowing fluid and proteins from the blood to leave the bloodstream and go into the tissue, and they also start bringing white blood cells out of the bloodstream into that tissue, so into the extracellular fluid of that tissue, so that we bring in these proteins that can attack pathogens and these white blood cells that can attack pathogens into the infected area so that they can then clear the pathogen. So that's just a little reminder of what inflammation is. You get an inflammatory exudate, which is the fluid with the proteins from the blood that can attack pathogens, and you get white blood cells accumulating in that area. So inflammation is a response that we give to any type of pathogen. Now, the common conditions that you will get inflammation in are of course, colds, flu, and also tummy bugs. These are the conditions that people commonly get, the infections that people commonly get. However, in response to any form of any inflammation anywhere in the body, you can get a tension type headache as a symptom of that inflammation. This is the type of headache you get when you've got inflammation going on anywhere in the body. And I should stress that this symptom arises because of the inflammation rather than because of the infection. When you have, let's say, a cold, that is an infection of the respiratory system. It is not an infection anywhere near the brain, for instance. It doesn't get into the blood, it certainly doesn't get up to the brain, and yet you get this tension type headache around the head. It's not that the infection is causing that. Do not think, this is a very, very important point, the infection does not go to the brain. It will be extremely dangerous if it goes to the brain. We will discuss infections going to the brain later on. Meningitis and encephalitis, we'll discuss both of those. They are extremely deadly. When you get a cold and you get one of these tension type headaches, it is not because the virus has gone to the brain. Instead, it is because where the infection is, you are getting an inflammatory response, and then that inflammatory response is leaking all sorts of mediators, inflammatory hormones, molecules into the bloodstream that are then going up to the head region and causing this tension type headache. So it's the inflammatory mediators in the bloodstream that cause the headache with these infections that are far, far away, not that the infectious agent has gone up to the brain. That's a very, very important point to understand. Infections in the brain are extremely dangerous. Headache occurs in those of not dangerous infections. So, these are the common sort of infections that people will get, and I'll just give you the proper term for tummy bug. Tummy bug is the common term, of course, but the proper term is gastroenteritis, which is infection of the stomach and the small intestine. So, all of these are common infections that will lead to inflammation at the site where they are occurring, and of course colds and flu are both respiratory system infections, whereas a tummy bug is a gastrointestinal infection. However, even though these are the common infections that can cause inflammation and therefore can cause tension type headaches, anything that leads to inflammation can lead to the same type of tension type headache. So much more severe infections that are potentially dangerous will also lead to inflammation, and this will cause a tension type headache as a symptom. Of course, this is the point where it really starts to break down my categorization, because even with the modern definition of primary versus secondary, of primary is unpleasant but not dangerous, I can't cover inflammation when it actually is dangerous under that. So that's where this categorization really does sort of break down. But know this, that when you have a headache as a symptom of inflammation that is occurring somewhere in the body, that type of headache is believed to be a tension type headache, even if it now seems to break this categorization of primary versus secondary, because we put this into the category of primary, but what if the cause of it is now something that actually is dangerous, well, that seems to break down the categorization, but don't worry about it. This categorization is fallible. It was man-made because we like categorizing things. Okay, so let me just talk a little bit more about these types of common infections. So, of course, tummy bugs, gastroenteritis, that is usually caused by a viral infection in the intestine, and the virus that usually causes that, and I'll get some dramatic colour for this, we'll have purple. The virus that usually causes tummy bugs is a virus called norovirus. So norovirus is the most common pathogen, a type of virus that can infect the gastrointestinal system and can cause inflammation there, and therefore can give rise to a tension type headache as a symptom of that inflammation. Colds and flu, these are both infections of the respiratory system. They're both viral infections, however they're caused by different viruses. So let me start by giving you the names of the viruses that can give rise to a cold. So the common viruses that can cause colds are rhinoviruses and coronaviruses, the two major types of viruses that can give rise to colds. And they infect the epithelial cells of the respiratory system. And usually they start in the nasal cavity, they then go back through the nasal cavity to the nasopharynx behind, they then go down to the larynx and infect the bottom portion of the larynx, and they usually go down into the trachea, and then they might even get into the early bronchi, the early airways of the lungs, and then the adaptive immune system will kick in and annihilate them. Of course, you'll have had the inflammatory response a long time ago, which will have been slowing their progress, but isn't strong enough to get rid of them. Then the adaptive immune response kicks in and annihilates them out. And they give rise to inflammation in those sites, which causes the tension type headache. And of course, you also get the respiratory symptoms of having this respiratory system infection. So you'll get a runny nose, a sore throat, also from the inflammation in the throat, a hoarse voice, again from the inflammation in the throat, from the voice box, the larynx, a cough from the inflammation in the trachea and the early airways, producing more mucus. Now, flu is, again, an infection of the respiratory system, but it's caused by different viruses. It's caused by the influenza viruses, of which there are 3 different species: influenza A virus, influenza B virus, and influenza C virus. Now, the influenza virus, again, it infects the epithelium of the respiratory tract, and it infects the exact same type of areas as colds do. It infects the nasal cavity, the nasopharynx, the bottom of the larynx, the trachea, the early bronchi, and then the adaptive immune system comes and annihilates it out. What then is the difference between a cold and the flu clinically? The difference is not in the respiratory symptoms. Both of them give rise to the same respiratory or local symptoms, i.e. they both give rise to runny noses, sore throats, hoarse voices, and a cough. The difference is in the systemic symptoms. Flu makes you feel extremely unwell, and the reason is that you get much more inflammation in flu than you do in a cold. And the reason you get much more inflammation in flu is that these viruses are much more deadly to the cells of the epithelium. These kill the epithelial cells much more easily than these do. These are very gentle on the epithelial cells they infect, whereas these end up killing the epithelial cells, killing a huge number of the epithelial cells they infect. Therefore, when you get dying cells, we know that that's a trigger for inflammation, so you get much more inflammation in the respiratory tract when you get flu. And when you get much more inflammation, of course, that means much more of these inflammatory mediators go into the blood, and that's what triggers the systemic symptoms. So fever, and all the accompanying symptoms with fever, so like chills and feeling very cold and shivering, and rigors where you're feeling very cold and actually shaking. Those are systemic symptoms of flu. Headache is, of course, a systemic symptom of flu, and that's this type of headache, a tension type headache. You feel extremely tired when you get flu. You might feel that your appetite is reduced, and you might also get muscle aches all over the body. And in fact, those muscle aches that you get in flu, they're believed to be extremely similar to the aches that you get in the head. The pathogenesis of those is believed to be extremely similar to the aches that you get in the head with flu that is causing the tension type headache. So remember, that's the clinical difference between a cold and the flu. They're caused by different viruses. These viruses are much less gentle on the cells that they infect, cause much more inflammation, and therefore give rise to much worse systemic symptoms. They make you feel absolutely dreadful. You feel extremely tired and you can't do much other than just lie around in bed. So when you get a respiratory infection, you've got the respiratory symptoms. If you're capable of still going out and doing life, living life normally, going to work and whatnot, then it's probably a cold. If you're not, if you're reduced to lying in bed moaning, then you've probably got flu. Okay, so these are common infections that people can get which will give rise to inflammation, and those inflammatory mediators will cause tension type headaches. Although, as I say, anything that gives rise to inflammation and puts inflammatory mediators into the blood can cause this type of headache, a tension type headache. Okay, right, and we'll discuss the pathogenesis of that later on. So, we've now done a description of tension type headaches. We've gone over the difference between episodic and chronic tension type headaches. And with chronic tension type headaches, it's usually that people are prone to emotional stress. We know, of course, that everyone is different in the population. That's what makes life so interesting. Some people are far more prone to having big, dramatic emotional responses to things than other people. If you gave two different people and you put them through the same emotionally stressful experience, maybe a marital breakup or something like that, these two different people can have very different levels of emotional response to that because they are different people. We know that different people have different levels of emotional response to things. Some people, therefore, are more prone to dramatic emotional fluctuations, more prone to dramatic emotional stress, and these people, therefore, are more prone to getting regular tension-type headaches, and they can even end up getting these chronic tension-type headaches where they're getting them almost every day. So when people are suffering from chronic tension-type headaches, it's usually because of emotional stress. That's the usual trigger that's triggering it. Another thing to add on as one of the symptoms of tension type headaches, and again this is going to be a symptom of a lot of different types of headaches, is something called cutaneous allodynia. So I'll put this here again in this pink colour. So cutaneous allodynia. Now what does this mean? You might have heard of this word allodynia before. This means that a stimulus that should not be painful now causes pain. So for instance, if I touch your skin, it should not cause you pain as long as I don't do it too hard. If I just put my finger and tap your skin, that should not cause you pain. That is a stimulus that should not cause pain. If for some reason that stimulus started causing pain, I touch the skin and it causes pain, that is what we would call allodynia. Allodynia refers to a stimulus that is not supposed to cause pain, that should not cause pain, should not usually cause pain, now causing pain. Cutaneous allodynia means that it's happening in the skin. So skin is gaining pain, basically. It's now going to react and give a painful response to stimuli that would not have previously caused pain. So, what can happen if you're suffering from very regular tension type headaches? And indeed, this is true for other types of headaches as well, but we'll cross that bridge when we get there. If you, for instance, have chronic tension type headaches, and let's say you get a bilateral squeezing sensation in the temporal region, so the sides of your head, what can end up happening because you're having such regular headaches that even in between the headaches, so let's say you're not having a headache at the moment, you're absolutely fine, but even in between, if someone was then to go and touch the portion of skin where you usually get your headaches, i.e. was to touch the side of your head, it might cause pain. This is what we refer to as cutaneous allodynia, that the site where you have the headache has now become hyper-responsive, basically. Stimuli that should not cause pain are now causing pain. So the parts of the head that are actually the parts which become painful in the headache can respond to stimuli that should not cause pain with pain in between headaches. So suffering from regular headaches in a certain region of the head can lead to this cutaneous allodynia in that region of the head. Okay, so that's another symptom of tension type headaches, and indeed that's a symptom of many different types of primary headache which cause regular headaches, that they can lead to this phenomenon of cutaneous allodynia, and we will seek to explain this. So, what are we now going to begin then? We're going to now begin our discussion of the pathophysiology of tension type headaches. And what are we going to seek to explain? We're going to seek to explain where does the pain come from, firstly. That's the first thing we want to explain. We also want to explain why do these triggers that we've been over here actually lead to this type of pain coming from. Other things we want to explain is nausea and vomiting. Where does that come from? Why do you feel sick and can actually be sick when you're in pain? Where does the cutaneous allodynia come from? And also, how does someone progress from having episodic tension type headaches to having chronic tension type headaches? So these are all questions we want to answer by studying the pathogenesis of tension type headaches. We'll then also want to ask, how do we actually treat tension type headaches? And when we're discussing treatment, we want to discuss two things: abortive treatment, which means how you actually stop the headache when you've got the headache, and also prophylactic treatment, which is preventative treatment. How do you prevent the headache occurring again? So those are things we still want to discuss about tension type headaches. So I think we'll have a break here. In the next video, we'll begin that discussion of the pathophysiology of tension type headaches.